Good morning. I'm Dr. Aisha Khalid, and I'll be your host for today's Quiet Echo. I want to tell you about a nurse in South Africa. His name is Bukosi Mdleko. He runs the Nsingweni Clinic in KwaZulu-Natal, a small building with fittings from the 1980s, serving 12,000 people scattered across the hills and valleys of King Cetshwayo district. His region has one of the highest rates of HIV in the world, and 96% of his patients on treatment have the virus suppressed in their bodies. 96% in a rural clinic, in an old building, with one nurse running it and a doctor who comes twice a week. I want to tell you how he does it. The story was published 2 days ago in Spotlight, a South African public health journal. I do not expect Cedar Valley has read it. I read it Thursday morning, and I have not stopped thinking about it since. This is the moment in the article where I stopped. Mdleko stood on a rise above the clinic and looked out across the hills. He pointed to a circular house made of concrete bricks. An old woman lives there, he said. She will not leave because her husband and forefathers are buried on the land. She lives too far from the clinic and has no way to get there, so he visits her. He pointed to another home, a child-headed household. He checks on them. He pointed to a house down in the valley where an elderly woman has been missing her medication. We need to check on her, he said. A major problem in his region is patients defaulting on treatment, not from indifference, because they cannot afford the bus fare. Let me say something about what 96% means in that context. In any context, a 96% viral suppression rate is remarkable. In a low-resource rural clinic serving a dispersed population, in a country where the distances between a patient and their medication can be measured in hours of walking, it is something else. It tells you a community has been found, not just opened for business and waited for. Mdleko grew up in Nsingweni, the son of a single mother. The community raised him. He trained as a nurse, worked in hospitals in Durban and Mpangeni, and came back. He says he is paying his dues to the people who raised him. He is also a pastor. He is building a church with his wife on the same land where he practices medicine. He says his faith is the starting point for whatever he does. He described his 12,000 patients with a sweeping gesture across the hills. These are all our people, he said. The old woman at the circular house, the children in the child-headed household, the woman in the valley who has been missing her doses, all of them his people, all of them worth the walk. I have practiced medicine for 20 years. I know what it costs to achieve a number like 96%. It costs the thing Mdleko does every day, going to the patient who has stopped coming in. Not waiting, going. Medicine in this country is organized around the assumption the patient will come to us. We build the building, we staff the hours, we make the appointment available. The patient shows up or does not show up. If they do not show up, we send a reminder. If they still do not show up, we note it in the chart. Missed appointment. We move on to the next one. Mdleko does not have the luxury of moving on. He knows where each of his 12,000 people live. He knows which ones cannot afford the bus fare. He knows the old woman will not leave her land. He built his practice around the patient who cannot come to him, not around the patient who already knows how. I think about the patients in my own practice who did not come back, the ones who meant to schedule a follow-up and did not. The ones who fell off a medication quietly, the ones I watched walk out knowing something was not right, but neither of us said it. I think about what I did for them, and what I did not do. Mdleko's circumstances are not Cedar Valley's. His distances are different. His disease burden is different. The resources available to him are not what we have here. But the question is the same. Who has stopped coming in? And have we gone to find out why? This does not require a clinic manager. It requires the willingness to notice when someone is absent and ask after them. A neighbor who has not been seen lately. A family member who cancelled their last appointment and did not reschedule. Anyone who has gone quiet about their health and no one has thought to ask why. I grew up the daughter of Pakistani immigrants. My parents came to this country knowing no one, carrying credentials the system spent years deciding whether to recognize. The people who helped them were neighbors who showed up without being asked. A colleague who walked my father through a credentialing process he could not navigate alone. A woman who brought food to our door when my mother was ill and my father was working 2 jobs. People who did not wait to be asked, people who just came. Bakosi Mdlek pointed across 12,000 people in the hills of KwaZulu-Natal and called them all his people. I keep thinking about what it would mean if each of us said the same about the people we can see from where we are standing. If you know someone in Cedar Valley who has stopped going to their doctor and you do not know why, you are not the only one sitting with this. The Cedar Valley News Facebook group is where the conversation continues. I will put the link in the show notes. This is Dr. Aisha Khalid, your host for today's Quiet Echo. Thanks for listening. This Quiet Echo is part of the fictional Cedar Valley News series, written by Evan Swenson, publisher, publication consultants, and Claude Marshall, AI developmental editor. While the people and town of Cedar Valley are fictional, Bakosi Mdlek, the Nsingweni Clinic, and the details described are real, as reported by Sue Segar in Spotlight on April 16, 2026.
You've been listening to the Cedar Valley News Podcast, where small-town voices meet the headlines shaping our world. From faith and family to front porches and fields. We'll be back with more stories connecting real lives to real events. Until next time, keep your porch light on, your faith strong, and your heart open. This is Cedar Valley News.